Hi family, I'm Kevin Cosmo. I'm a medical student over at Western University, father of 4, an ultramarathoner, and creator of High Energy Parenting. And in today's video, I want to share with you what is a DO. What do doctors of osteopathy do? Essentially, I'm going to give you a quick rundown of what a DO is, especially in relation to a medical doctor or an MD, and as well, some of the background, history, philosophy, tenets of DO, and ultimately, why I want to become a doctor of osteopathy. First off, what is a DO? So DOs are very much like MDs or allopathically trained doctors. They both require 4 years of medical training. They can both specialize in any particular field. A DO could be a pediatrician, a DO could be a surgeon, or a DO could be a family doctor, as I intend to be. And osteopathic practice is one of the fastest growing healthcare professions, with now 1 in every 4 medical students going to a school of osteopathy. DOs practice according to the latest science and with the latest technology in medicine, yet they also have their own technology, their hands. DOs offer osteopathic manipulation therapy, which essentially allows them to diagnose and treat illnesses and injuries right on the spot with their hands. It's a fantastic tool and a fantastic thing to offer to your patients. As well, DOs tend to look beyond the symptoms. They focus on a whole person approach to healthcare, and so oftentimes they're looking into the lifestyle factors, the environmental factors that play into our expression of health or disease. Now let's jump into a brief history of osteopathy. It all started back in the late 1800s with a physician named A.T. Still, or Andrew Still. His father happened to be a surgeon. Well, he was a practicing surgeon, medicine man, because he happened to be a priest. And at that time on the American frontier, those who were associated with God, the priesthood, were often called upon to do healing as well, because at that time, most people thought that healing came through God. Well, Andrew grew up in this, and so he was able to be exposed to his father's books on physiology and biochemistry and see surgeries happen, and he grew up with that medical training. Yet there was one distinction about Andrew's family in that his father was anti-slavery, which made him rather the outcast in the community. And so in the religious community, Andrew's father was assigned to work with the Shawnee, the native population, who had warred with the European settlers at the time, and so there was not good relations. This was kind of his short stick he was being given. Well, this left A.T. Still to be exposed to now a native population's understanding of health as well. And Andrew had quite a bit of revelations while working there and seeing what his father was doing and seeing the effects that the Shawnee population had with their own healing mechanisms. Unfortunately, during this time, Andrew had 4 children who suffered from pneumonia and all passed away. And this led him to make this bold statement about medical care because each of his children were under medical care, receiving traditional care at the time, and yet none of them fared too well. Not until I had been tried by fire did I cut loose from that stupidity, drugs. Not until my heart had been torn and lacerated with grief and affliction could I fully realize the inefficacy of drugs. So with this disillusioned perspective on modern medicine and with his newfound perspective on the natural healing mechanism of the body and the natural vitality of the body if taken care of, A.T. emerges into the European world and begins to perform healing with his hands, which is unheard of at the time. And so many of the people at the time fear his behavior because they think it's coming from pagan, devil, native type of medicine, and it's not what they're supposed to be doing. It's not coming from God. But A.T. Still has this very interesting perspective, and it comes through in this quote about his perspective on God. I decided then that God was not a guessing God, but a God of truth, and all his works, spiritual and material, are harmonious. So wise a God had certainly placed the remedy within the material house in which the spirit of life dwells. So we see A.T. is now starting to perceive that the body has its own healing mechanism and that he is able to just work with it with his hands to set up the environmental factors, the lifestyle factors, to allow that natural intelligence, that natural God force to come through and create health. So that's his perspective, and that's how he's going back into the world. But it's not seen like this, it's not accepted widely, but his results are hard to deny. There was one interesting story about a preacher's wife, and while the preacher was away, their daughter was lame already before he had gone away, and the wife had, begged the preacher, let's try out A.T. Still's approach. But no, I mean, it's ungodly at this point. But while the preacher was away, the wife goes and calls upon A.T. Still, and he comes to the house and performs his osteopathic manipulation therapy, as it became, and lo and behold, the girl is able to walk again. And as the story goes, her father comes home, and she comes out and runs to greet him and gives him a hug, and it's undeniable the effect of the treatment that A.T. Still was able to give, and so the preacher in that area acquiesced and allowed Andrew to practice in that area. So we see ultimately that A.T. Still recognized the natural healing of the body, the natural intelligence of the body, and so his goal was no longer to drug or poison or force the body into working. He was going to work with and try to allow and help the body do what it would naturally want to do by providing the substances, forces, and the conditions allowing health to thrive. Even with A.T. Still's fantastically effective results and with his students' fantastic results, there was still much resistance from the society, and so this is why, even though A.T. Still resisted attaching medicine to osteopathy because he thought medicine related to drugs and ineffective surgeries, there was need to attach osteopathy to medicine to allow it into the mainstream, to allow these osteopathic physicians to become licensed and become acceptable within the mainstream model that dominated the day. So that about covers a brief history of osteopathic practice. Now let's jump into the philosophy and tenets behind osteopathic practice. The first one being that the patient is a whole person. Body, mind, spirit. All of these factors play into the patient's expression of health or of disease. I have a link down below for the 33 elements of health that I use and understand as all the requisites needed for health and all of the factors playing into our expression of the health, or all of our factors that we could be mismanaging that allow us to experience disease. So a DO takes all these factors into account when they're making health recommendations for a patient. The second tenet being that the body has its own innate intelligence. Right now I'm not orchestrating these trillions of cells, thankfully. I don't think I can manage that. My children, each of them have their own intelligence within. You call it a spirit, a force of nature, God, whatever you want to call it. There's something fantastic working within each of us that turns the substance around us, the air, the food, the water we take in, into this life form we call a human body. What a wonderful thing, and what a beautiful thing to practice respecting that with our medical practice. And A.T. Still was so brilliant in recognizing that we can work with it. We really can't force it without causing damage along the way. The third principle of osteopathic practice would be touch. OMM, osteopathic manipulation, is such a brilliant way of connecting with the patient as well as allowing the physician to diagnose and treat the patient's illness or injury. Structure and function are reciprocally interrelated. If you have proper function, you must have proper structure. If you have proper structure, you can allow for proper function. And both play into each other and both allow a physician to diagnose through improper feeling of structure or function, and then also allow a physician to play into healing through correcting the structure or correcting the function. So it's a brilliant tool, and that's the third principle of osteopathic practice. And this principle alone is a very interesting distinction between the allopathic practice and the osteopathic practice, in that the osteopathic physician has something in their toolbox that the allopathic doctor just does not. The fourth principle of osteopathic practice is preventative medicine. It's look-ahead medicine. Rather than waiting for you to show up with disease symptoms, osteopathic practice, because of those first three principles, allows a physician to look into the lifestyle and environmental factors that play into the person's expression of health or of disease, and then create a treatment plan or a protocol allowing the patient to have fantastic well-being for a lifetime, with hopefully not presenting disease and avoiding any chronic conditions at all. The fifth philosophy of osteopathic practice is liberty, truth, and health. And it was this philosophy that I think most attracted me to osteopathic practice. Dr. Still, immediately when he opened up his college, opened it up to men and women. This is before women had the right to vote. This was not heard of at the time, and yet he didn't mind. He was about liberty, truth, and health. And that, to me, is what I want to be about as a doctor. He was about self-autonomy, about health autonomy. And yet, osteopaths at the time were considered rebels for following conservative measures of healthcare, for following the science, regardless of whether popular opinion allowed it or not. They followed the truth. They allowed for openness and liberty at a time when it was scorned and considered heretical. Even to this day, some of the things that osteopathic physicians talk about, such as diet impacting one's health and experience of disease, is still fringe, still kind of considered heretical. Type 2 diabetes, should you be able to get rid of it with your diet, or should you just stay on drugs, metformin, and insulin for the rest of your life? Osteopathic practice, thank goodness, pays attention to the fact that the body is self-healing and respects the fantastic intelligence and uniqueness of each individual, And yes, the body can heal for most conditions. And so thank you, Andrew Still, for creating Osteopathic Practice. And I hope that gives you a brief understanding of what a DO is and why osteopathic practice is a fantastic thing to study if you're thinking about becoming a doctor. Until the next video, live joyously, live passionately, keep getting healthier, family.